Good day. Flat feet or flat foot are probably the most common cause of referral to an orthopedic pediatric surgeon. Flat foot consists in a deformity and a flattening of the middle arch of the foot. You have to consider anyway that the foot is flat from the utral phase of the child, and progressively the arch forms up to approximately 15 years of age. Flat foot is something that you should correct when at that stage is not completely resolved. During early life, when the child is 2 or 3 years, insoles may help the plastic bones of a little baby to model one to each other better than to left alone. So insole, in my view, should be suggested when a grade 3 or 4 flat foot is present at 3 or 4 or 5 years of age, not to improve the formation of the arch, which is something physiological due to muscle, different lever arms, but is good to suggest it and to propose it to the parents to improve the development of the bones themselves in the foot. Flat foot treatment is under major debate still in the orthopedic world and in the pediatric world. Some people believe that insole with proprioceptive sensors may help the foot to develop and the medial arch to form. Definitely when the child is 14 or 15 years of age and the foot remains flat, the flexible lever arm, this is as the foot is called, becomes insufficient and should be treated to improve the push-off phase during gait. Minimally invasive surgery with a screw in the talus or in the calcaneal bone may resolve immediately the problem and form the medial arch. This is called calcaneal stop in the Italian world and is called subtalar arthrolysis in the international world. It consists in a 1 centimeter incision on the lateral aspect of the sinus tarsi, an insertion of a screw, and 1 stitch of suture. Postoperative treatment in the flat foot, if it's minimally invasive and early, it consists in 2 days with no weight bearing and then progressive weight bearing according to pain and free back to sports in 1 month. In the scientific world, there's no special description in scientific paper on which shoes you should use to improve flat foot or you should use when you're going to do sports and you have flat foot. Some cases of flat foot depends on a tight Achilles tendon. So if you have a solid sole of the shoe, it will improve self-stretching during walking and gait and will help flat foot correction. Normally, any shoes you have should be comfortable and should have an insole in the medial part of the foot to avoid major pronation. It has also been suggested that some exercises to improve power in the tibialis posterior tendon and in the flexural lucis may help to recreate the medial arch. This is still under debate. Flat foot surgery is more common in Europe than in North America. We perform normally around 300 to 400 cases a year with terrific results, back to motion straight away, no plaster, 1 stitches of suture with reabsorbable, so the patient is discharged forever unless pain or problems straight away after surgery. The mean time in hospital in my department for this surgery is 2.5 hours. I'm always available for any question, any doubt, or any problem you may have, because I understand as a father that every minimal problem with your kid can become a major disaster in your mind, and it's better to have a straightaway answer and clarification so you can relax for something that is normally not important. I'll be happy to answer you on the YouTube channel anytime you write.